now. We're good. Okay, Neil, go ahead. Turn it over to you.
Well, it's just, I'm not sure how loud I'll have to speak, but I'll try and project my voice to. It's just a pleasure to be here this evening. I haven't attended a lot of these meetings, but Don Lalonde, who isn't here tonight, has been faithful in inviting me. And so tonight I'm here, and we'll get a chance to share a bit about the last 8 years in my life, because they've all involved prostate cancer for the last 8 years. It's been an interesting story, and I think if you notice at the bottom there, my story isn't going to be your story. And that also means that the way I've responded to some of the treatments isn't necessarily the way that you will respond to some of the treatments. By the way, Pluvicto has gone ahead with miles, Murray. There's 7 or 8 people on treatment here in Saskatoon already, and it all relates to an hour conversation I had with my oncologist back in July of 24, when I basically sat him down and I said, no more chemo. And that was a hard thing to do, because you want to not only obey, but want to take the recommendations of your oncologist when you do something. And this was a tough time, but I'll tell you the story a bit. It was a rough time getting there, but the Pluvicto, as a bottom line, cleaned up. I had about 8 tumors in my chest and about 6 or so in my lower abdomen, and it cleaned up all of those tumors, except, and I'm standing here tonight a bit weak and wobbly on my legs, because I had to go through some more treatments this fall, because they found one tumor in my liver that did not get caught. Now, let's start at the beginning, and then we'll get to that. I don't know if you can see that, but for me, the diagnosis happened in December of 2017. Can you see it at the back there? We can probably turn down the lights if we have to. I don't know. Can you turn some of them down?
It's kind of like all or none.
Can you see them? Can you read that from the back? No. That's better. So December of 2017, I had my diagnosis. I had, interestingly enough, sometimes and many times these things get caught very late. And in this case, I would say that my diagnosis was found early by my general practitioner. And he was using a really, really high-tech tool when he diagnosed it, and it's called his finger. And not many of the GPs are actually using their finger anymore, but it was very valuable to me. He just found a roughness on the prostate and said, I think you should go and see a urologist. And by the time I got onto the surgery table, the tumor had more than doubled in size. So it was very aggressive, and it was growing fast, and so I'm thankful that we got that step done. That happened in February, early February of 2018. The results of that prostatectomy were very satisfying from the standpoint of the surgeon. And when I looked at I tend to look at the medical reports with a little jaundiced eye because of all the reports I've had to look at over the years. And all of the lymph nodes were clean. They harvested 9 lymph nodes, and they were all clean. One thing that I did not focus on, and to this day it's probably an error that I made, was on the histology slides. So they will take slides of the line where the surgeon cut, where he cut the prostate out. And on these histology slides, it showed that there were some precancerous cells left in my body at that time. I was happy that the lymph nodes were clean, and my wife had colon cancer about 20 years before that, had some not so good things happen with the radiation. And so at that point, I pushed back on the radiation and said, well, let's continue with the hormone therapy and see where we go from there. And so it was in 2020, they found several, June of 2020, 2 masses on the pelvic floor. And so I was treated with 37 days of radiation. And I restarted the L-Guard because they had seen the PSA stay low the entire time. Here's another thing. When I say that our stories won't be the same, in this full 8 years, I've never had a PSA count higher than 2.65. And so it's known as, and it's actually recognized in the research, and it took me a bit to sort it out, and then I had to share it with my oncologist, because the oncologists really focus on the PSA. I mean, they do. They're so busy, and so if the PSA is looking low, then they don't worry too much about it. But in 2020, they found those 2 masses, and I started back on L-Guard, a hormone therapy product, and did the radiation. So then, it wasn't until May of 2022 that my radiation oncologist called and said, I'm just checking in. He says, I don't see any problems, but he said, I'm just checking in to see how you're doing. And certainly I was strong, and I was feeling good, and really quite active at that point. And I said, you know, my PSA has gone up just slightly. He says, that's really low yet, so we won't worry about it. So first time that an oncologist had, in my mind, double-crossed me or hadn't been able to take the time to sort out why I had a low PSA where many men would not. But I kept him on the line. It was a phone consultation. I kept him on the line, and finally he said, well, when did we do your last CT scan? And I said, I can tell you that. It was in September of 2021. Well, he says, why don't we do another CT scan? And at that point, they found spreading. That's when they first identified the metastases, where it spread to my chest and to my abdomen. So I had no pain. I had no evidence in my bones or my bladder. So this was all, for the most part, related to just masses, individual masses. And in my chest, it was about 7 or 8 lymph nodes. And in my abdomen, it was in my liver. They could see different shades of density in my liver, plus a number of other masses. And so they didn't believe it. They said, well, this has to be some other cancer. And so instead of jumping in right away, they spent an extra month and did another liver biopsy to to see that confirm that it was actually metastasis from my prostate cancer, and it was. So in August of 2022, I started chemotherapy with docetaxel. A cycle of docetaxel is 21 days. Some of you may have gone through that already. Some of you may not have, but a cycle would be 21 days, and the routine was to go through 6 cycles and see what kind of response they got from that. And the response looked really quite good, but it sure, docetaxel or chemotherapy in general has some rough side effects, or at least I felt some rough side effects. I was helping to harvest that fall out at the farm, and one day I was fixing a swather knife, and it was 32 above, and I just finally put the tools down and left the tools on the canvas and drove home because I was just getting too weak. And with chemo, how many have taken chemo already in this? Several of you. It's additive. So the cycles, as you go through the cycles, the side effects are additive. Would you agree with that? Or maybe you're not.
I had no complaints for my chemo.
Okay, so maybe you didn't have docetaxel at that point, or maybe you were just strong enough to handle it completely. By the 6th cycle, I was getting weaker, and it took me a bit to get back on my feet. And really, we live close to the field house, so the field house is my buddy, and has remained my buddy many times over. But along with that, I had really bad neuropathy, both in my feet and in my fingers and thumbs. And of course, dry mouth is something that was the other side effect that I felt a lot with the chemo. I wasn't liking chemo because I had had several friends who they had used chemo on as a last resort. And they were both gone within about 4 or 5 months after they finished their chemo. And it was probably the timing, because both of them had had bone cancer along with the other metastatic prostate cancer, and had other chronic conditions. And chemo, if you're strong and your immune system is strong, and my immune system was good, it hardly was affected during that first 6 cycles. If you're a strong person and healthy with no other problems, whether it be heart or lungs or kidney or liver, the chemo, you can handle it, and it's often quite successful. If you have other problems, and I'll get to this in a few minutes when I talk about the Pluvicto, because, by the way, that is now an option. Pluvicto is now an option in Saskatchewan, has been since June, and the government's paying for all the product, and also paying for the PET scans. So you're in a little different situation now than I was when I looked at it a year and a half ago. But my oncologist, once he realized, or how should I say it, once I convinced him that I had to go to the Pluvicto, and he saw the results, he finally admitted to me, he apologized several times for being so slow on not wanting me to go out to Burnaby. It was a private clinic in Burnaby that I went to. But you have to realize that oncologists are busy, and they have protocols. They have protocols related to budgets that the government has given them. And so many times we're looking or hearing things about new treatments that are coming out, and the government is pushing back because they don't either see the evidence yet or they don't want to bear the cost. But I had learned to know about the Pluvicto. Let's not get ahead of myself. So just to give you a few other things. So my PSA, just a sidebar. I used a naturopath for about a year during the time that I had my chemo, and I found him very, very, very helpful. And this is a special naturopath. He is in Saskatoon here. He's a medical doctor as well as a naturopath. And so I went to him by a recommendation. His name is Dr. Joseph Schnurr. He's at a wellness clinic down on Lorne Avenue. And from my perspective, being in the work that I was in holistic health medicine medicine for livestock, he has been the only MD that I've learned to know that had a more holistic perspective of how to treat the human body, including nutrition and exercise. And so he did help me in some other ways, but basically told me, Neil, you've got to keep exercising and you got to push yourself if you get struggling. And then he gave me some recommendations on nutrition, what to eat and what not to eat, to reduce sugar intake in my body, of course. So the next thing that happened is I was frustrated because I had a young oncologist at that time, and he, again, as I mentioned earlier, he focused only on the PSA. And in my case, I knew by that time it was low, and it stayed low, stayed within normal range all the time. And so I did some research and soon found a really good research article related to metastatic prostate cancer where the PSA remains low. And they immediately emphasized in that article that you should use the CT scan every 3 months to monitor the progress or the changes in the tumor sizes in your body, whether there is some new growth or not, rather than the PSA. And so I insisted that we start that, and he agreed with that he would start using CT scan every 3 months. And that was helpful to me, only in that I could always, every 3 months, I could see those tumors growing. And so that wasn't helpful. He remained, in October of 23, he remained focused on the chemotherapy as a treatment. He had me on abiraterone, which is another hormone therapy. And don't ask me to give you the mode of action for each of these hormone therapy products. But I was on Elgard, and I went on abiraterone 2 after I was finished my chemotherapy. And 6 months later, the tumors were still growing. And here's an interesting thing, and it gives you some appreciation of the human aspect of the doctors that are treating us and looking after us. He walked into the room one day, it was in July actually, of 23, and he said, well, he didn't even ask me how I was feeling. Of course, the nurse had taken a history. But all he said was, the only option is to give you 10 more cycles of chemo. And I sat there, it kind of pushed me back a bit, but I sat there and then I grinned and I said, well, you know, you haven't been around me the last 6 months. Or you might know that I've been known to say that I'll never take another treatment of chemo again in my life. And we'll give that some perspective in a few minutes here. So he was very resistant, and I was already talking to him. I'd brought him the application to go to take Pluvicto treatments in Burnaby in October of 23. All of this started because a friend of mine, my wife and I had a house in Arizona for 15 years, and our best friends were right next door, and he had been in the phase 3 studies of the Pluvicto treatments product in the US in 2021. And so there was about 900 in their group in LA, and it was also being, there was a group, I guess, in Vancouver, which I wasn't aware of. But they his wife and him reported to us all the time how the results were going and what kind of side effects he was having with the Pluvicto compared to the chemo, because he'd been at the Mayo Center clinic for a number of years. He had it in his bones. His PSA was up over 300. And they said one day to him, they said, well, we've done all we can for you, so you can go home. Now remember, this was in 2021, and things keep changing here, and that's why I suggest to you that there's probably more changes coming. But they would come home and tell us how things were going, and he went through this phase 3 study, did six treatments. I took 5 because it was coming out of my own wallet, and we'll maybe talk about that a little later. But he had good results, almost no side effects at all. Dry mouth and maybe a little soreness in his muscles and joints for a couple of days, because it is a fairly heavy radiation level that you're being given. And part of the protocol is that you'll be isolated in a hotel for about 2 days, about 48 hours after you take the intravenous treatment. Because although people don't know you're glowing, you are actually glowing. And I always chuckled because it was only a 10-minute intravenous that they gave you. And then the gal would come back in about 15 or 20 minutes later with a Geiger. And she'd stand at the door and measure the radiation level in me with this Geiger counter from the door. And part of it was that the treatment, the dose of treatment is unique, is individual for each person. It would get flown over from Italy at that point, and I suspect still is. And they wanted to make sure that what went into my body, and then she'd measure what was in the glass vial yet to make sure that they had got the full dose that they were paying for, and I was paying for. So it was the private clinic was exceptionally intense and very good service that I received out there. The abiraterone, he was coming back to the young oncologist. That day when he told me that 10 more treatments of chemo was the only option that was available to me, I could see in his eyes he was mad at the abiraterone because I'd only had it for 6 months. And he really thought that probably it should be helping me or slow or stabilize the tumor growth for about 2 to 3 years. He expected it to help. And here it was only 6 months. And he came in and he was actually almost angry at the drug. And he wasn't worried about the host. But he was angry at the drug because it wasn't doing what he expected it to do. And so you've got to appreciate sometimes these people get very busy, and they have a box that each product fits into, and when it doesn't respond that way in your body, then then they don't know what to do. Because again, as I reminded you, they have a protocol that they have to, that they can use or have to use in terms of the amount of money that they are spent on each product and each client. So the chemo metastatically continued to spread. October of 23. It was fortunate because he ended up that month leaving for Edmonton, and I got an older man that had spent 20 years in the UK and was here for 17 years and knew what Pluvicto as a nuclear medicine product could do. And so when I told him about it, he still resisted it, but at least I had him thinking. So I went on my own out to Burnaby in 2024 to Initio Clinic in Burnaby, and I got the scan called a PET-CT PMSA scan. So it's a specific PET scan to the antigen that's in the cancer cell, prostate membrane specific antigen. So there is an antigen, and the foundation, that is the foundation for the product that I received. And one thing you should be aware of is that the Nuclear Medicine Foundation in Pluvicto is only at this point available for metastatic prostate cancer. It's not available for breast cancer or pancreatic cancer or other cancers. The oncologists that I worked with out in Burnaby would say that in the next 10 years, that foundational antigen or protein that is unique to each cancer will be found for each cancer. But at this point, this is the only one that has been registered and is being used today. So I went out there in January because I wanted to know whether I had a normal prostate metastatic cancer cell or whether I had a positive PMSA positive cell, because the Pluvicto will only treat the PMSA positive cancer cells. They can't guarantee that I might not have some other metastatic prostate cancer cells in my body. In this case now, it would, let's say, it might be in my liver. But the Pluvicto will only treat those cells that are PMSA positive. And it's quite a unique, they identify the antigen or protein. They develop a receptor that attaches to that cancer cell, and then they just tie the, let's call it the isotope or the radiation product to the receptor, and they give you that through an intravenous in a 10-minute treatment every 6 weeks. And it will only go and attach itself to those cancer cells that are PMSA positive. And I took 5 treatments, so every 6 weeks. I finished them in February of this year. At that point, with a PET scan in March, they said that my cancer was under remission. But basically, it was basically them saying, we can't see any other tumors in your body. The liver is a unique one, and my oncologist had warned me that the Pluvicto may not be as effective in the liver as it is in many other parts of the body, including the bones. He said the Pluvicto has given really good results, and they had 70 or 80 people that they had treated already with Pluvicto at that time. And so I wasn't surprised. I came, I guess it was just before we headed for the coast in late June, And my oncologist called me and said, I want to do an MRI. And at that point, my PSA, let's go on here. Yeah, it's at the bottom there. It was 0.07 in June. It went to 0.18 in July, went to 0.34 in August, to 0.45 in September, and 0.67 in October. And to most of you, that would be inconsequential. And to your oncologist, it would be not important. They'd say, well, there's nothing there yet. So that was very unique to my condition. But by this time, my oncologist recognized that really any shift in PSA was meaningful in my particular case. And so it was that, with that in mind, that they went on. Well, there's a few stories between that. In 2024, March to May, I had a cancerous lymph node that blocked half of my left lung. I thought I had bronchitis for about 3 months. And finally, they identified this lymph node that was blocking the airway. So I was in St. Paul's Hospital for 2 weeks and that was unique. Did 5 radiation treatments over a 5-day period, and I could breathe again. Within 10 minutes or 10 days, I could breathe fully again. So there's a lot of things that they can do, and that was one of the more remarkable ones. On June the 5th, the oncologist recommended a series of 3 chemo treatments simply because of the struggle I had had with the breathing. And I shook my head and I thought, what do I do here? Because at that point, he hadn't given me permission. This is the older fellow now. He hadn't given me permission to go to Burnaby to take treatments. And even though he wasn't paying for it, or the government wasn't paying for it, I still wanted his blessing that I could go, and that because they'll be monitoring the blood work every 2 weeks, every 2 weeks back here. I finally agreed to 1 chemo treatment, and it just flattened me right out. And it was a combination of 2 things. It was the product that they used, and it's a cousin of docetaxel, but I don't remember the name. And C. difficile. Who knows what C. difficile is? Clostridium difficile. Have you heard about it in the news over time? That it's in the hospitals. It's a Clostridium bacterium that is very antibiotic resistant. And so they've struggled with it in hospitals over the last, I would say 10, 15 years ago, you started hearing about it infecting the hospitals. And I suspect that I got it in St. Paul's and picked it up there, and then they gave me another chemo treatment, and the combination of the chemo treatment and the Clostridium difficile just laid me right out. And so I was in RUH for 2 weeks, came home on June 25th on full oxygen and using a walker. Got to tell you just a little story about C. difficile. I ended up being a pig veterinarian of all things, and I traveled the world teaching and coaching and managing different production units on how to manage their animals better. But in 1994, I found C. difficile in the pig barn in Saskatchewan. And that's the first time that it was ever found in livestock in North America. And in fact, the microbiologist, they couldn't actually even culture it at that point. They used the toxin to measure that it was actually C. difficile. So if you ever thought of something going around and coming around, it came around about 25 years later, and I saw it again. But we got through that, and in early July, I said to my wife, I said, I need to sit down with Dr. Iqbal and have this conversation so that I can go to Burnaby and get Pluvicto. I knew by that time that the side effects probably should be minimal, and they were. Very much like Bill had in the States, sore muscles for a couple of days, sore joints for a few days, and dry mouth was about all you felt with the Pluvicto. At this point, I'd like to introduce a statement that Dr. Iqbal told me after he saw the results of what happened with the 5 treatments in 6 weeks apart, because my PSA went to non-detectable. Within the second treatment that I had taken, they couldn't see the PSA at all. I wasn't surprised because I had always had a low PSA. But what was interesting was that I was going to tell you something, now it's gone. So we'll just leave that. So the story I've shared is that I went into remission. I stayed in remission until June, when the PSA started to move, and they did an MRI. And so if you didn't think I was a guinea pig until then, Dr. Iqbal was really helpful with me, and he says, well, I think we need to consider embolization. Well, I didn't even know what the word meant. And the liver department, the specialists in the liver department at the RUH are the ones that do this procedure. And so he couldn't even explain it to me himself, but he knew where I had to go. And so I ran into a fella in August, Dr. Liu, a Chinese doctor, about 60 years old, very, very keen, excellent service heart, just wanted to help. And so we went through this procedure. It was a procedure that I really took 4 times to get to the treatment level. So the first 3 were simply setting up the blood circulation, the arterial circulation around the tumor. So now instead of a generalized treatment for your whole body, like you would get with chemo, which would affect your whole body, this was to affect only the area of the tumor. They would go in, they'd use the radial artery on my wrist here, and the 2 catheters that they ran in there were 2 millimeters in size, one inside the other. And they would run it up my arm to the back of my brain, down through the aorta, the main blood supply, and drop into the liver. And then they would map the blood circulation around the tumor. And at that point, the tumor was about 4 centimeters. By the time I was finished, it was 9 centimeters. So it was growing while they were doing these procedures. But he did what they call mapping to see where the circulation of the arteries from the time it went through the tumor went to other parts of the body. But because they didn't want to put a product into the tumor that would damage or leave the tumor and damage other parts of the body. And so they used a tracer on the first mapping and realized that about 32% of it ended up in my lungs. and said, well, that's not good. So, but he went ahead with the second step, which was the embolization of blocking off these arteries to see if he could get a balance between allowing the product that he was going to give me, and that's quite an interesting product, I'll explain in a minute, and allow it to get into my tumor and yet not spread to any other place in my body. And then 2 or 3 weeks later, they came back, used another tracer to see that he was successful with the embolization. The embolization was really tough. I had a fever for 2 weeks, and that really hit me hard. I just spent 25 days on a combine, enjoying life and having a good harvest, and then I went through this embolization procedure. But he was able to reduce it to 9%, and so he said, no, we'll risk that. And so then came the final step of the embolization, where they take radiation impregnated glass beads and they run it through the catheter. So think of the outside catheter as the camera as it's going up through. So he was just sitting there with a remote on a computer running this catheter up through my arterial blood system into the liver. And then the inside catheter, which had to be smaller than probably a millimeter or just over a millimeter in size, that would carry the product that he was going to dump into the tumors. And so that has been done. That's been done about 4 weeks ago. It takes about 3 months for them to figure out whether they've been successful or not. And so now I'm back at the field house, getting my legs back underneath me and taking it from there. There is something else. If they see that that tumor has shrunk, but has not completely, it still has some activity, Dr. Liu, who's the senior liver specialist at LUH, he would go in and do a microwave aplasia. You know what an aplasia is. We use that term with people who have a racing heart, where they'll go in with either liquid nitrogen or electricity and burn out the ectopic pace makers that have set up in the heart muscle. Some of you may have heard that from friends. Well, this would be electricity of some sort that he's going to use to do that. But I won't be able to end that story for a while. Well, what have I learned? Consistently exercising is important at every level of treatment, whatever you can do. Every detection at every stage is important. Early detection at every stage is important. And so the next statement is probably the most important one on this page. Use an advocate, if at all possible, who can understand some medical terminology and procedures. The professional providers are very, very busy people, and like humans may not stop to think about what they just told you. And I already gave you the example of all you've got left now as a choice is 10 chemo treatments, 10 more chemo treatments. If you take somebody with you, if they don't necessarily have the medical background, at least have them writing down as you go to each of your visits, or even if it's a phone visit, have them writing down what they hear the oncologist say. Because these women and men are very busy, and it's not getting less. For the chemotherapy up in that ward in Saskatoon here at RU8, or the cancer center, I know one of the nurses there, and I took my chemo back in 2022, and she would say that they are treating 2.5 times as many people a day now as they did in 2022 in that in that ward. And so we've got to realize that they're human. And, but in this case, I think it's worked out as good as it could. Being a patient with PSA that stays abnormally low all the time meant that I had to find another means of closely monitoring the progress spread of the cancer. Pluvicto now given in Saskatchewan and paid for by Saskatchewan Health Authority. Same with the PET CT scan, PMSA scan.
So you can get it here now?
You can get it here now. Now, here's the statement that Dr. Iqbal told me when he was being honest with me finally. Besides apologizing, he said, about 2/3 of the people that get chemotherapy should not. They should jump right to the Pluvicto. And the reason is because of other factors in the body, where they have a heart condition or a kidney condition or some other problem that they're struggling with. And I had the sad experience of seeing several of my friends pass away within a few months after going on chemo. So I knew it wasn't all great. And you had a pretty good experience, I would say. You look like a strong man yet.
It's still ongoing.
Oh, it's still ongoing. What cycle are you on?
5.
Oh, you're doing okay. Okay. And I think it was the 5th cycle or 6th cycle where my legs really started to get numb on me. But my immune system stayed normal, completely normal during those first 6 cycles. And you haven't seen any change in your blood cells as far as you know.
That's right.
Yeah, well, that's great. That's great. Do you want to know the cost of 1 dose of Pluvicto that the government pays? It's Novartis, it's the company, and the government pays $27,000 per treatment. I paid cash, so I got a 10% discount on it. The PET scan, do you know what that cost is? $3,200 per scan. And they do these all now. They started the scans in May and in June, and Dr. Iqbal has kept me up to date on this. He now has 7 patients on Pluvicto, and I think a few in Regina. Certainly the one gentleman has called and he's already started or will start. And so they're realizing that the damage that can happen, me having to live with what feels like frozen fingers within 5 minutes after I go out to blow snow, or the pads of my feet are numb all the time. That isn't, I mean, I can handle it. I can get along with that. But it would have been nice if I could have avoided it too. Now, I took it early maybe I missed one thing here, and that was when Pluvicto was registered back in February of 22 in the States, and then registered here in Canada in August of 22. Of course, the governments didn't want to use it because it was too costly. But they also have never taken the time to think through the damage that can happen to people that have to take chemo when in fact they shouldn't have, or their body couldn't handle it. And so this would be hospital costs, medical costs, and so on. And so that would be something I've challenged them. I said, if you ever had a research study that showed how much medical damage was done with chemo, and Dr. Iqbal said about 65% of the patients would jump over the hormone therapy levels, and I'm still on hormone therapy, and go right to Pluvicto. The side effects are remarkably less. It'd be remit if I didn't say that my faith has remained an important aspect of the strength and peace that I experience daily. If any of you are interested in talking about that, I'd be more than willing to share or talk with you about it. I've learned that life is to be lived one day at a time, embracing the joy and happiness that it brings. And just like I mentioned, 25 days operating a swather in the combine this fall has been therapeutic for sure. I think that's it, Murray.